Hello, my name's Leslie Cohen. I'm a plastic surgeon in Richmond, Virginia, and I would like to talk to you about breast health and plastic surgery. First, a little bit about breast cancer. Breast cancer is the most common cancer in women in the United States. There are 232,000 breast cancer cases in the United States, and of these, 22,000 each year are male breast cancers. The median age at diagnosis is 61 years of age, and the overall 5-year survival rate is 90%. Breast cancer is the second leading cause of cancer deaths for women in the United States. The lifetime risk in the general population is 12%, and for a person with a first-degree relative with breast cancer, that increases for 2 times the population risk. What can women do to address their risk of breast cancer? All women can do screening and early detection. So for screening, that means early testing to find cancer or other diseases in people who have no symptoms. Screening can help find cancers when they are small and have not spread, and when they have a better chance of being detected. Breast cancer screening is done with mammograms, clinical breast exams, and sometimes MRI or ultrasound. Why do we screen for breast cancer? Breast cancers that are found because they can be felt tend to be larger and are more likely to have spread beyond the breast. Breast cancers found during screening exams are more likely to be small and confined to the breast itself. The size of a breast cancer and how far it is spread is important in terms of predicting the prognosis or overall survival outlook. Our current general medical guidelines are, when a woman is between ages 25 and 39, she should have a clinical breast exam every 1 to 3 years and practice monthly self-exams and self-breast awareness. From age 40 and up, a woman needs an annual clinical exam, a yearly mammogram, and she should practice monthly breast self-exam and breast awareness. For women who are at increased risk, this means greater than 20% average lifetime risk of breast cancer. Beginning at age 30, these women should have a clinical breast exam every 6 to 12 months, an annual mammogram and MRI, and consider risk-reducing strategies. What can you do to address your risk of breast cancer? Get screening. If you are age 40 or older, be sure and get your annual mammogram. Speak to your doctor about your breast cancer risk, as well as your family and medical history. Find out if you need to start testing earlier, or possibly have an MRI along with your mammograms. What else can you do? You can change the risk factors that you can control. That means get to a healthy weight and maintain that throughout your life. Be physically active. Each week, that means exercising at least 150 minutes of moderate intensity exercise. That is approximately 30 minutes 5 times a week. Or exercise 75 minutes a week for vigorous exercise. That is at least 15 minutes 5 times a week. We can do this. Limit sedentary behavior and limit alcohol. That means not more than 1 drink per day for women and not more than 2 drinks per day for men. I want to talk briefly about breast health and plastic surgery. Having breast surgery does not change a woman's risk of breast cancer. Screening and self-exam are still necessary after breast surgery. Following breast enhancement, additional views on mammogram are needed, and you should speak with your mammographer to let them know that that will be the case. After breast surgery, the next mammogram will be your new baseline. A little bit about breast implant safety. Breast implants do not impair breast health. Scientific research has found no link between autoimmune and other systemic diseases and breast implants. Breast implants are not guaranteed to last a lifetime, and future surgery may be required to replace implants. Pregnancy, weight loss, and menopause all may influence the appearance of augmented breasts. Breast-augmented patients still require regular examination both to evaluate breast health and the condition of the implants. What can we do? It's important to care for yourself. Women are busy, and often oriented toward helping others. And women often put others' needs ahead of their own. It's important to take care of yourself. By doing so, remember, you will be better able to take care of others.